Okay, I think we are recording, and I would like to introduce myself. I'm Melissa Veravetto, and I'm the manager of the Live Well Senior Program at Glendale Adventist Health Glendale. And today I'd like to welcome Dr. Matt Liu. And Dr. Liu joins us from Glendale. He lives in La Cañada. He's been born and raised here, and he was actually born at Adventist Health Glendale. So he is a homegrown physician, and that's always fun. So Dr. Liu, I think we'll spotlight you and have you take it away. There we go.
Perfect.
Welcome.
Well, thank you so much, Melissa. I appreciate it. First of all, it's so great to see everyone's wonderful faces. We live in a time where we only see half the face, so it's nice to see everyone's full face. It's been about a year, so it's wonderful, and it kind of gives me a little deja vu of what it was like before the pandemic. So it's good to see you all here, and thank you for coming, and thanks for Adventist Health Glendale for allowing me to kind of talk and chat and have a discussion with you all today and answer any questions that you might have. Like Melissa said, I'm kind of born and raised here. Went to elementary school in La Cañada. I went to La Cañada High School, and then went away for college, and then back again. And it's been great. And I was born in the hospital. Same with my siblings and it's been really a great experience coming back home and being able to help my community that I grew up in. It's such a wonderful community that we live in, great hospital, Adventist, and I've been loving working there. It's been about a year and a half since out of residency, and then coming back and working with my father. And it's been really great. So let me share my screen really quick. All righty. Perfect. So I think first of all, just want to start off. I'm a very kind of warm, and I kind of like, comedy and things. So I'm going to start this off with just a very short comedy video of probably common doctor's visits that you have all had with your primaries. Okay, so I'm going to start this. I'm not going to do the full screen because it gets a little laggy. So, all right.
I'm fine now, I think. I don't know. So they sent me to my regular doctor for a follow-up, and I was nervous going because my cholesterol... I knew it was going to be high because last year it was high, and I hadn't done anything different. What are the odds your cholesterol is going to plummet for no reason? Come on, 200, come on! 337, how can that be? I had Burger King coupons in my pocket. It's inexplicable. So I was nervous. And I realized that's the only time as an adult that I feel like a little kid, is when I go to the doctor. You didn't do what I told you, did you? No, I didn't. What should you have done? I should have listened when you were talking to me. What are you going to do from now on? Pay attention when you say things. When are you going to start? I'm going to start right now. Immediately. Call doctor. He's a good doctor, I think, I told him I get heartburn sometimes, so he goes and gets me a list of things that cause heartburn. I'm looking at the list and I'm like, I already know this. I know how to get it. That's like going into the hospital with a cannonball wound and they show you a list. Here's how you get cannonball wounds. I have a cannonball wound. It's gaping. Do you have a tube of cannonball wound ointment? Number one, do not stand directly in front of a cannon. How true that is. So my doctor looks at me and says, you should probably drop a couple pounds there, Brian. Thank you. Only your doctor has carte blanche on insults. He just insults you for a while, and then you pay him for the insults on the way out. Boy, you should lose some weight, and those moles are looking pretty weird. All right, how much for that, Doc? When can we get together again? Big fat mole man walking out of your office. Thanks for the confidence boost. I'm off to the Macy's Day Parade. Grab a rope! What is he?
All right. So just a little comedy. All right. So I'm going to pull up my PowerPoint. Okay. Let's go one more. All righty. So give me 1 second. Okay. So these, just a little introduction. So here's my family. I have 3 kiddos. This is my wife, my beautiful wife. So I have Brody, he is 6, and then a set of twins. This is Calvin, and this is Maddie. Maddie, as you know, being the little girl and the youngest, technically she rules the house and tells us what to do. And they are almost 3 years old. They'll be 3 years old at the end of next weekend, actually. So, and then Brody being 6. These are kind of them candid moments. Here's Brody. He went back to school. He's in kindergarten right now. They started back to school actually beginning of Thanksgiving. So they've been distance learning, putting pods and everything. I know a lot of your, kids and things are kind of going through these crazy times. But there's Brody. And then here is, here's Calvin enjoying some corn dogs, the good old nutritious food that kids love. A lot of times as parents, I know you guys have had, right? You kind of give them whatever they eat. If they eat, great. And they're surviving, fantastic. We'll go with that. So here's Calvin enjoying that. And then here's Maddie with her mischievousness and her sassiness, just kind of drawing on everything, including herself. Now right here, so I did come back in 2019 in August when I started working at a residency, and I'm working with my father. It's been an absolute blessing and an honor to be able to work with him. He's got years of knowledge, and it's been so great to continue to learn from him and to work with him side by side. And it's funny, all the patients I use a lot of times come in, they ask, "Oh, so how's your boss? How's working with your boss?" And trying to get some dirt or anything. But honestly, it's been fantastic. It's been such a great, a lifelong dream. Growing up, I used to go on rounds with him in the hospital, see his patients in the hospital, and I remember sitting at nurses' stations in the hospital and going to meet a lot of his wonderful patients. And it's always been passion of mine to kind of really help people like he does. So this was one of the fairs Adventist had, I think in 2019 in the fall. And then here on the right hand side, this is my eldest Brody and my father as well. So he took Brody on some rounds, kind of like he did with me when I was a child. And this is where in the L&D department, labor and delivery department. And that's where, and he kind of wrote a Facebook post about it and how saying it was really a deja vu because, here I was born in that labor and department building here at the hospital at Glendale Adventist, and now he's bringing his grandson there and in the same spot. So it was pretty cool. But it's been great being back and working with him. So that's just a little bit about me. So I'm going to go in. I've been asked to talk about this topic about, well, if you have something happening, where do you go? I think that's a big question that a lot of people have. Well, hey, do we go to an urgent care? Do we go to my primary? Do we go to the emergency room, right? And you have 3 great options. And, when is it that I should go to one or the other? What are the limitations of one setting versus the other? And what are the extent of things that people can treat, especially me, as a family medicine physician and a primary doctor, what are things that I can do to help people and to treat? So we'll go to the next slide. So, primary care, I kind of group primary care and urgent care into one group versus the emergency room, right? So, main things is, okay, primary care, urgent care, non-life threatening illnesses or things going on. And then obviously the emergency room, right, being life threatening. So hopefully you don't come in with an axe in your head, come to your primary and be like, I need help, right? I think that's a pretty obvious one. But what we'll do is we'll talk a little bit about common things, and maybe some symptoms that people don't know of very major things that you should go to the ER for. And then afterwards in the Q&A, I'm more than happy to answer any situations that you may have questions of what to do and where to go to. All right. All right, so primary care doctor, urgent care versus the ER. So emergency room, obviously, in regards to what they have available, they have everything available, right? And then if you need to be observed or need to be admitted for continued care, obviously, that's what you can do. Now, primary care offices. So, in regards to on-site, like blood draws and things of that sort, it's very rare and uncommon for an actual primary care doctor to have a phlebotomist in office unless they're a bigger group and on-site. I know there are a couple, but it's not necessarily the most common thing. They may have an actual organization, maybe like a Quest Diagnostics or LabCorp, or for instance, in my instance, in our office, we have Adventist lab draw down on the bottom floor of the Physician Medical Terrace building. So, we may have associated lab draw companies in the same building, but not necessarily in-house per se. Things that we do very commonly: strep throat, influenza, like flu tests, and probably very soon COVID tests. If these things continue to last longer and may turn into kind of a flu-like situation. Urinalysis for urinary tract infections. We can do an EKG if you're having some chest pains, and I'll get to that a little bit more as to, okay, well, where do you go? Obviously, vital signs for blood pressure problems, wound closures. Now, thing about wound closures is, we may not be available the same day. If we have a same day appointment, great. And not all primaries, do kind of wound closures in the outpatient. They may just send you to an urgent care. So, going down to urgent cares, again, majority are able to do blood draws on site and get results pretty quick, so they can kind of evaluate and see what's going on. Again, same thing in regards to the primary doctors. They can do pretty much the same thing: strep throat, flu tests, urine, EKG, vitals, wound closures. Now, in regards to wound closures, they are very common at urgent care sites. So if it's something that, if you have a wound, you got a gate, you fell, right, you have a laceration, or, you have a skin flap that's kind of open, you need to get that taken care of, urgent care is probably your best bet, because they can take you a lot quicker than your primary can. And they have more time to kind of make sure that you're cleaned out and sutured well, and et cetera. Also, they can perform x-rays. Again, very uncommon to have doctor's office with an x-ray capability actually in the office itself. Again, they may have associated, radiology groups, or us being at Adventist, we just send them down, down to the West Tower to get x-rays if needed, but uncommon in just the private doctor's offices. And IV fluids. If you're dehydrated, you've been sick, you've been kind of nausea, vomiting, diarrhea for about a day or so, and I just need, you just need some fluid resuscitation, maybe feel a little better, but just pretty dry. You can technically go to an urgent care to get IV fluid rehydration. But that's something they can do. They can give injection, pain relievers, and they have pretty much a lot of the capabilities that majority, if not all the capabilities that primary care can do. So what's the main reason? Now, I kind of grouped primary care doctor to urgent care as one group. Now, to separate them, well, where do we go, right? So I think one of the big things is hours, right? Your primary doctor is probably open from 8 to 5. And the thing is, again, too, is, a lot of times they're booked with appointments for the general physicals. Appointments have been booked a couple of weeks in advance. So they may not have an opening that day. And if you have a cut or a laceration, you need to get sewn up or things of that sort, go to your urgent care, all right? The other thing is after hours. Again, urgent cares a lot of times or majority of the times are open until 7, 8, 9 o'clock at night. And in that case, if it's after hours, you definitely go to an urgent care. That can be for everything: medication refills, urinary tract infection if you need antibiotics, or an upper respiratory infection if you need to be checked out, etc. You can go to an urgent care. Now, obviously, urgent cares, a lot of them are not open 24 hours. So, after the urgent cares close, then your only option would be the emergency room, where they would kind of triage you. And a lot of, the emergency room, they do have kind of a triage location where it's kind of for more of the urgent care type of situations and problems. So they can kind of get you in and out. So that's kind of the main difference. And if you want to get in quick, if you need something quick, and if you call your doctor and they can't see you right away, for example, for a suture or something, then go to an urgent care. But a lot of times, if you need a refill of medications, if you need an antibiotic, you're like, hey, I have this cold, a urinary tract infection, let me know. You can usually reach out to your primary. They can get back to you within the same day. and give you a call. They can make a quick, telemedicine appointment, right, without you necessarily having to come in, especially nowadays, and kind of get you those antibiotics. Primaries can take care of pretty much everything. And if you ever have a question, yeah, you can call your primary and see. Okay. Just a little chart. So in difference in between the three: urgent care is shorter wait, primary care is limited same day appointments, just because of prior appointments that have been made in emergency room. You have a longer wait time because of the urgent cases that are going in there. Copay wise, obviously urgent care is a lower copay. Primary could be about the same as an urgent care, if not the same. Emergency rooms, it's a higher copay. And the same thing, less serious conditions for urgent care. Long-term preventative stuff is what us as primary do. We can do urgent care type of things as well, taking care of the cold, sick, flu, strep throat. We can suture sometimes if time allows, so we can do that, and those types of things. But it's mainly kind of chronic management of things. And then the emergency room are life-threatening emergencies. Here's just kind of a short list of reasons to go to both either an urgent care or your primary versus the ER. All right, so allergic reactions, minor. Again, I'm grouping primary care doctor with the urgent care. Okay, so allergic reactions, bladder infections, bug bites, minor burns, cough, diarrhea, ear pain, fever, flu, minor flu symptoms, vaccines, immunizations, cuts, right? Minor cuts, pink eye, sinus infection, skin infection, sore throat, suspected broken bone. And the other reason, and now on the other side, to go to the ER, right? So severe abdominal pain, severe allergic reaction. By severe, I mean, like, you know what? Your throat's starting to swell up, your tongue's starting to swell up, your mouth. If you're allergic to like a bee sting and you get stung by a bee, don't go to urgent care, go to the ER, right? Because you have a very severe reaction to it. But your urgent care, all they're going to do is give you some Benadryl, maybe a shot, and then they're going to send you to the ER. So just go straight to the ER, okay? Burns, severe burns, so that's like possibly second, third degree burns. Broken bone with dislocations. If you break a bone and something's sticking out, it shouldn't be sticking out. It's an ER visit. Chest pains, coughing up blood, a deep cut that won't stop. If you're having really bad shortness of breath and it's really hard for you to walk, across the room to go to the bathroom and without taking a deep breath and sitting down, that's probably an ER visit. Fainting, fever, a lot of times infants under like 2-3 weeks. Any infant with a fever and that young should go to the ER. Loss of vision, head injury, fever with neck stiffness or rash, and that's just to rule out meningitis. That's a common meningitis sign. You have a fever and your neck is really stiff, and possibly a headache. You want to rule out meningitis, and that's a very life-threatening illness if not taken care of quickly. Seizures, obviously, and sudden numbness in face, arms, or legs, indications of a possible stroke. Okay. So I'm going to go over a couple of conditions that are life-threatening. And I know a lot of you know these things, just a good review. I am going to try to point out some more of the some of the symptoms that's maybe a little bit more on the minor side that people may not think of in regards to these things. So for instance, like a stroke, right? So there's a saying, be fast, right? So be balanced. If you lost a balance, you have a headache or dizziness, it just comes on like all of a sudden. Your eyes, you start having blurred vision, maybe on one side or both eyes. The face, one side of the face is drooping. So you can kind of look in the mirror, if you look, you kind of see your labial folds here. And if one side's kind of going down, the other side's going up, that's a facial droop. One way to double check is smile. If you smile, then this side's going to go down, this side's going to go up. Okay. Arms or leg weakness, usually it's one side. A lot of times it is one-sided leg weakness and arm weakness that can happen with a stroke. Speech difficulty, trouble expressing, right? Or you have slurred speech because of that facial droop. It's just hard for you to talk clearly. And a lot of times they have aphasia or expressive aphasia. People can't say what they want to say. They know what they want to say. They're completely intact in their brain and they know what they want to say, but it's hard for them to actually say it. And then time, right? It's time to call for an ambulance immediately. If it is a stroke-like symptoms, that's call 911. The only reason why is an ambulance will come pick them up and they'll go straight to the ER, because then they have communication with the ER saying, hey, we have a possible stroke and you need to get taken care of immediately, because they can give you something called TPA, which can kind of break up the clot if caught within 3.5 hours. And again, there's certain circumstances that us physicians, we kind of take into consideration as to, or do you qualify for it or not. but also they can go in and retrieve the clot if necessary. But time is the biggest factor in regards to stroke. So call 911 right away. Don't say, hey, I'm going to drive to the ER. Call 911, because then they go in the back way. They get taken care of a lot quicker. Okay. Now, sometimes people with strokes will say, hey, I'm just a little dizzy. Like it just came out of nowhere. I've been fine before. I'm a little dizzy. My balance is a little off. If that's the case, I would side on the caution of, okay, well, maybe go to the ER, call your primary, if anything, and explain with him if you're unsure, but go to the ER, because some people have these little real minor symptoms of all of a sudden they're just kind of dizzy and their balance, it's hard for them to keep their balance. So, be on the lookout for those types of symptoms. Next thing is a heart attack. Now, in regards to heart attack, there's the typical, everyone knows, right? I know I'm preaching to the choir. Oh, chest pain, maybe kind of goes in your jaw, maybe your left arm a little bit. You can sweat a little bit. You can have a little shortness of breath. And it's that chest pressure, like an elephant sitting on your chest, right? So there's a lot of things, with men sweating, same thing, like it's just chest pain, shortness of breath. And one thing that a lot of people may kind of put off aside is heartburn or indigestion. And let's say you're normal, you've never had heartburn before, but you do, you've had a heart attack in the past, maybe 5 years ago, you had a stent placed, and all of a sudden, out of the blue, you have this acid reflux. You didn't eat spicy foods, no like tomato sauces, nothing you feel like a kid off, but you had this heartburn for the last couple of days. That's pretty bad. You take some Tums, maybe it helps a little bit, but not very much. And you have this heartburn indigestion feeling. You should probably talk to your primary or get to the ER. It could be a heart attack. I recently had a patient, same thing, where he had maybe 2 or 3 stents placed in the past, and all of a sudden he said, hey, I'm having this heartburn, and he doesn't really have a heartburn history. All right, so he had this heartburn all of a sudden, and ended up, he had another heart attack and had another stent placed. So that's one of those uncommon heart attack signs. Now, not all heartburn is a heart attack. All right. Now it comes with a history. If a history of heart attacks, then yeah, I'd keep that on your mind, but not all of them are heart attacks. And women have different symptoms in regards to heart attacks. A lot of them, again, they may have a minor indigestion, they may have some dizziness. All of a sudden, they may have unexplained fatigue, or they have trouble sleeping, like it's just kind of out of the blue. And again, indigestion and your typical chest pain, shortness of breath, those types of things. But like the fatigue, unexplained, all of a sudden fatigue, sleep disturbances, and dizziness. If you have a good family history of heart problems, and it's kind of on your radar, that's something to consider. Okay, you can kind of go to your primary. They can run an EKG in the office and see. But if that chest pain starts coming on and you're kind of fatigued and you're like, I have this little chest discomfort, go to the ER. All right, go to the ER. All right. Urinary tract infections. Now, you might be asking, well, why urinary tract infection? It's pretty simple. You get an antibiotic, say, hey, my urine's burning. I get an antibiotic and I'm fine. But a lot of times in the elderly, we don't know, they don't have typical signs of a urinary tract infection. So a lot of people, the majority, you'll hear about, okay, burning with urination, blood in your urine, or increased frequency of urination. Those are kind of your triad of the common common symptoms of a urinary tract infection. But things that sometimes we don't, especially in elderly who we can't express maybe what's going on. They may not have those symptoms at all. And they'll just say, hey, I'm just feeling a little down. I feel a little weak, like it's hard for me to kind of get up. I don't have the strength like I did before. Or people that have some confusion or delirium, right? Maybe some malodorous urine, pelvic pain, obviously, sudden changes in behavior or agitation. Some people who may have dementia, for example, who can't really express what they're feeling. If all of a sudden their behavior starts changing, or they all of a sudden become agitated, you're like, this is not them. And one thing you may want to consider is checking their urine. Make sure that it's not a urinary tract infection. A lot of people in skilled nursing facilities, long-term kind of care facilities, urinary tract infections are common because if they're incontinent, they're in a diaper, and it's a higher potential for urinary tract infection. So, and the same poor motor skills or dizziness, again, you may not have that typical urinary tract infection type of symptoms. So just kind of look out for those types of things. And the reason why I put this in is that it can, if it's there for about a week or two, it can progress to sepsis, which is basically an infection of the blood. It gets to your blood, and that's pretty life threatening if it gets to that point. And you probably need IV antibiotics and et cetera. So once these symptoms start coming, either for you or a loved one, contact your primary and try to catch it early so it doesn't progress. All right. And then appendicitis. Okay. So again, common things, right lower quadrant of your stomach, right? Severe pain that just comes on like that pretty quick. Okay. On the right side of the abdomen, you get some nausea, vomiting, decreased appetite. You may or may not have a fever. May have some bowel, changes, constipation, diarrhea, and may have some bloating symptoms as well. But I think one of the main things is that for appendicitis, one big thing is that the pain can be around your belly button, kind of in the middle, and it can start out there and then gradually can migrate down to the right lower quadrant of your stomach. And again, this is like a sudden, it just kind of it comes out of nowhere. And one way to judge if it is appendicitis is anything that you provoke it will cause a pretty big pain. So if you jump, there's a jump test, we call it. If you jump and it causes that severe pain to come in, it's pretty likely that it is an appendicitis. So that's an ER. That's an ER visit because you got to go to the ER. What they'll likely do is do a CT scan or an ultrasound, probably a CT scan if anything, and then you may need to get surgery. I had a couple patients recently, same thing. She was about 68 years old. Called me and said, hey, a couple days, like my stomach has just been hurting all of a sudden. It was around the belly button first, and then now it's like the right lower side. And I told her, go to the ER, and she had to get an appendectomy that night. Another one, my brother-in-law, his brother, so he's about 25, and he had abdominal pain for 2 weeks. Can you imagine that? 2 weeks. And then he ended up calling my dad and said, hey, what should I do? My dad said, hey, go to the ER. Sounds like you have an appendicitis. And it ruptured. It ruptured, and he had to get IV antibiotics. He had to be in the hospital for about a week and a half. So, these types of things don't sit around, right? And I think as we grow older too, our pain tolerance gets a little bit better too. So it may not be as severe, but just be on the lookout, contact your primary if anything, right? Okay. So that's, those are kind of some basic life-threatening things you should go to the ER for. So I'm just going to briefly talk about telemedicine, and then afterwards, any questions or concerns, any scenarios, I'm more than happy to kind of instruct you as best as I can to answer your questions. So just a lot on telemedicine. This really kind of came into effect with the pandemic. It's been around for a while, but insurances and other insurance companies basically have not necessarily supplemented or paid for telemedicine services until the pandemic. So it was good because it kind of progressed this kind of new age of medicine per se of how to see your doctor. Pros and cons, right? Obviously, you're not there. Your doctor's not there, with you. He can't necessarily examine you and listen to your lungs and palpate and touch and see you, right? Benefit of it is it's at the comfort of your own home, right? So, we send you a link or text message or send an email to your computer, and you click it. We can do a video visit, and there's actually a good amount of things we can do through telemedicine. I found it very not necessarily surprising, but very convenient for a lot of people. And I felt like a lot of people felt like they could follow up more because you didn't have to drive to the hospital, you didn't have to find a parking spot, you didn't have to then go to the doctor, you didn't have to set apart necessarily an hour and a half, 2 hours of your day to go see your doctor. And people can see them in 15 minutes, and they can stop whatever they're doing and see their doctors. Now, I've had some funny instances in regards to telemedicine, in regards to just dropping what they're doing and seeing their doctor. So, I've had people driving and they're on their phone, hands-free, but their phone's up on their dashboard, and they click accept the call and they're driving. And I'm like, what are you doing? Pull over. I don't want you to crash. I'm not going to be the cause of your demise. Like, don't crash, but I'm going to hang up right now, pull over. And when you're safe, then go ahead and click the link again and I'll talk to you. People in the middle of work, right? So construction, these guys in construction workers, they're literally up on scaffolding and they're having a doctor's appointment with me. And other people in the line, one lady was there for a cough. And of course, she's at a grocery store in line waiting to pay for groceries. And she picks up and we're having a doctor's appointment there and it's for a cough. And I'm like, you probably shouldn't be out with the cough in the middle of a grocery line checking out, first of all. Right? And then now here you're talking to your doctor saying you have a cough, have a fever, etc. Like, that's probably not good. But yes, somebody who was in the bathroom. So we get all kinds of telemedicine visits out of this, but you can see how convenient it is for a lot of people. You just jump on, you're done in 15 minutes. We can send prescriptions over. We can have you do certain maneuvers if it's a certain joint pain and kind of diagnose, oh, you may have this. We can send you for imaging, etc. In regards to if it's going to stay, that's really up to. I'm hoping so. I think it makes it a lot easier for a lot of people, especially people. It's a hard time getting out of the house. It makes it more accessible. The doctor's appointment more accessible to them. And unfortunately, it's all in kind of the insurance hands, whether they continue to promote and pay and reimburse for these visits. I'm hoping they do. Especially with this pandemic, we're still kind of in the time of watch and wait to kind of see what these new strains and et cetera. So, but in the foreseeable future, I think yes, insurance companies will continue to support that. So it's been going great. It's been going pretty easy. I think majority, if not all of our patients have been able to adapt pretty well. And it's a pretty easy process. What we use, we just send people a link or an email with a link in it, kind of like Zoom. For you guys joining the meeting today, all you do is click a link, you allow camera and microphone access, and then boom, you're connected with your doctor. So it's as easy as that. And I think, in the future with this telemedicine kind of picking up, they'll probably start having devices, blood pressure machines, probably heart rate monitors and things that may be able to start connecting to these programs. And that way the doctor can get your vitals during the visit. So anyways, so that's kind of all from me, and I'm open for any questions or concerns or from anybody.
Okay. So doctor, I think we have some questions in the chat, and I know that the Live Well members, they know how to do that. So if you wouldn't mind just repeating their question and doing your best to answer. And if it's not in your realm to answer it, that's fine
Absolutely.
too.
Absolutely. Okay,
Okay.
so the first question I see says, if in the beginning